Hi there, welcome to my channel. Hi guys, welcome back to another episode of Nursing with Ingrid. Thank you so very much for stopping by yet once again. I truly appreciate it. I hope everybody is well and safe and in good health at this point. I would like to say thank you very much to all my new subscribers. Welcome to the family, and to my returning subscribers, welcome back. The aim of this video is to make us more aware of what programs are out there or what courses are out there that will assist us and help us stay up to date with regards to emergency management of patients as in the hospital as well as out of the hospitals. This will also apply to people that are not in the medical field but can give first aid help in an emergency situation. This video was suggested by one of our colleagues that is up in Johannesburg, and I'd just like to say thank you very much. So let's start from the beginning. Initially, as a lay person or the general public, you are able to go in and do the first aid course, which is accredited, and it is also recognized. And when you do this course, you learn how to handle a person that is bleeding, or to stop the bleeding or manage the bleeding. You are able to splint a fracture. You are able to take care of a sprain. You are able to take care of somebody that is choking and assist him in that way before the medical team or the first responders get to the scene. So those are the things that are quite important to help save a life and be proactive in the moment that an emergency happens. With first aid, there are 3 levels. There's level 1, that is just for the general public. Level 2 and level 3 are designed for individuals that want to start doing the first aid in order to get into the emergency rescue program and become paramedics. So that will help you. The level 2 and 3 first aid will help you to get your foot in the door with regards to getting into emergency medical services. The next level of life support that is out there for the healthcare workers is the BLS course. Okay, with the BLS course, it's called the basic life support, and with that you learn how to handle and take care of a patient that has either respiratory distress or cardiac distress. And you also learn how to use an AED, and the points that you get from that add up to your CPD points. You get allocated a certain amount of CEU units, and that goes towards your CPD points, which is part of your continuous professional learning and growing. Once you've done the basic life support program or the course, you get certified, and that certification is endorsed by the American Heart Association. So that is a valid course that you can do and is recognized internationally, and it is valid for 2 years. So that means that every 2 years you need to upgrade and do a refresher in order to maintain your certificate. Otherwise you have to start all over again. And it's very important that we keep these certifications and ability to help patients at any given time, because when you move from one institution to another, that is one of the things that helps you get along to the next level of your career. When it comes to the nursing, nurses normally get this training in their final year of their course, and with the doctors as well, the final year of medical school, that's when you will do the BLS course, and it will be valid for 2 years. The next course that you can do after you've done your BLS, but you have to have your BLS in order to do your ACLS. And when you're doing your ACLS, in that course as well, you will be allocated some points that go towards your continuous professional development, and they give you a few continuous education units as well. And when it comes to the ACLS course, this is where you will learn how to administer drugs. You will learn how to use the AED, which is an automated external defibrillator if your patient is in cardiac arrest. And you will learn these things as you progress within the courses that you do. And please, I want everybody to bear in mind that given the current situation that the world is in at the moment, the way we do CPR and resuscitations has been modified because of the pandemic and what it can expose health workers to. So you also need to be up to date with what is the latest recommendations when it comes to resuscitating a patient, and when it comes to maintaining an airway of a patient that you are not sure whether they are a negative or a positive patient, right? So those are the things that you also need to take into consideration, is keep yourself up to date with what the current trends are and what are the current changes that have been made to the original BLS and ACLS course. Moving on from the ACLS, you get to do another course that is called the Experienced Professional, internationally recognized, that is also recognized by the American Heart Association. This further advances you and makes you more valuable within the health environment or within the hospital environment, because you get to learn a little bit more. You become a little bit more experienced when it comes to emergency medicine, and you can be of a great help. And it's always an asset to have people that know what they're doing, when they need to do it, how they need to do it, and make sure that everybody is safe in the process. General public as well, there is also the CPR course, right? And with that course is important because you also are able to, at that point, learn how to use an AED, which are available within our surroundings, in the restaurants, in the supermarkets, in the drugstores, in the malls. So you know exactly what to do, how to use it, how to assess a patient first and foremostly, and diagnose them and do the appropriate rescue or resuscitation that the patient will need at that particular moment. It is also important to note that if you do the CPR course and you are not a medical profession, but you have a discovery medical aid, you will get 2,500 points, vitality points, towards your vitality program once you've done the CPR course, as well as the first aid course. The CPR course is endorsed by the Resuscitation Council of Southern Africa. So you can go and you can do that course with any of the training institutions that do offer the CPR course. And it's also important to note that within our working environments, institutions, whether it be in an office space or in a factory, wherever you work, you also need to be able to do CPR and first aid as according to the Occupational Health and Safety Act 85 of 1993. So in accordance to that act, people in the working environment or institution need to know how to perform CPR and to do first aid. That is a requirement. For the pediatric specialists, there's also a PLS course, that is the Pediatric Advanced Life Support course. That is something that you also need to do if you are working in pediatrics and in the neonatal ICU. These courses are available, and you are advised to do them because it will help you save that baby's life. It will help you do the right thing at the right time to help save a life at the end of the day, because that is the end goal. Whichever department or unit you work in, you need to be proficient in emergency plan and what needs to be done in order to save a life. I would also like to say that with regards to basic life support or whatever emergency care that you'll be giving a patient, it is important that you know exactly what your institutional policy is with regards to resuscitating a patient. Each institution has their own protocol or SOP with regards to how to resus, who gets resus, what happens, who gets called, and all of that. You need to familiarize yourself with that. And if you're entering a unit for the first time and you're going to be working there, please make it your duty and your responsibility to familiarize yourself with the resuscitation trolley as well as the resuscitation procedure. This will help you a lot, because at the end of the day we find that when there's an emergency in the ward or in the unit, sometimes there's people that are more of a hindrance than a help. So by you knowing exactly what is on your trolley, your emergency trolley or your resus trolley, that will help a lot with regards to assisting the rest of the team in resuscitating a patient. So get yourself familiarized with the equipment as well as what is in your resuscitation trolley. Also, when it comes to your resuscitation trolley, please make sure that it's checked every day or according to your protocol. Please make sure that you are checking the expiration dates on all your drugs, your expiration dates on all the equipment that is in the trolley itself. That is your needles, your syringes, your IV cannulas. All those things need to be in good use or have a good expiry on them, and please change them out as soon as possible, and make sure that you replenish that resuscitation trolley as soon as you've used it, or if you've taken something from it, please do replace it, because an emergency can happen at any time of the day, whether it's day shift or night shift. So let us all just be proactive when it comes to our resuscitation trolleys, that they are all in good working order, the equipment is working, the stuff that is supposed to be in the drawers are there and are available. I would also like to stress to everybody that if you haven't done your BLS for a while and it's expired, please try and make a plan to get your BLS up to date and valid, because that is really a necessity for each and every one of us as healthcare workers. Every single day you need to have your BLS or your ACLS or whatever you have certified yourself in or trained in. So please make sure that you keep all your documents valid and worth it for the 2 years that they are valid for. In the description box you'll find that I've put the Netcare 911 numbers that do offer these courses, as well as BLS Medical that also offers these courses for the public as well as for healthcare workers. So please make sure that you have a look down in the description box down below, and you will get all the information down there with regards to the courses that I've just mentioned right now. Also, at this point I'd like to say that every little thing that you do to advance your performance in the health sphere is going to be very valuable to the patients and to our clients at the end of the day. So we need to keep ourselves up to date all the time with the growing trends, with what's available at the moment, and keep ourselves agile and ready for action in order for us to best serve our patients or our clients for that matter. I would also like to ask you to please put any comments down below if I've missed out something. If I've left out something, please put a comment down below, because we know at this point that that's where all the learning takes place, where we communicate between each other and everybody gets to learn at the same time. So please feel free to put a comment or a suggestion down below for something that I haven't mentioned, or something that I wasn't too clear on. If you care to explain it further, please be my guest and put a comment down below. If you haven't subscribed, please do subscribe. If you like this video, please give it a massive thumbs up. And with that, as usual, I'd like to say take care, stay safe, God bless.